Madam President, I come to the floor again today, as I have week after week since the health care law has been passed, with a doctor's second opinion about the health care law. As you know, I've practiced medicine for 25 years in Wyoming, taking care of Wyoming families. And, Madam President, I have great concerns about this health care law that has been passed by this body, as well as the House, signed by the President, and the American people continue to learn more and more about this health care law, and the more they seem to learn, the more concern they have about this health care law being bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for the payers, the taxpayers of this country, who are going to get hit with an incredible bill. And now, Madam President, the main thing I want to talk about today is a new report that has come out that says to me that the taxpayers are going to get hit with a bill even much higher than they initially thought. And it's a report from a group. It's the McKinsey Quarterly, and it's called "How U.S. Health Care Reform Will Affect Employee Benefits." You know, Madam President, in the debates and in the speeches that the President had given in the run-up to the election and the vote on this bill, he said that if you had care that you liked, you could keep it. That American people had a plan that they liked, they'd be able to keep it. And it was a promise that he made to the American people, a promise that the American people wanted to believe. But now this report shows that the American people were right in being skeptical. And as we see, the more the American people learn about the health care law, the less they like it and the more they oppose it. So what this report says is that it is a shift away from employer-provided health insurance, will be vastly greater than expected, and will make sense for many companies and lower-income workers alike. And when you work your way through this report, what you see is that more and more private companies that today provide health insurance for their employees will be much less likely to be willing to provide that insurance in the future. Well, why? Well, because it's going to be a lot more expensive to provide the insurance. The mandates, the quality, and the high level of expense involved with providing that insurance, so that's going to be a significant burden to those companies. And if they don't provide the insurance at all, that there are going to be other chances for those employees, and it will actually be cheaper for the business to not provide insurance, give the people a raise, but just pay the penalty of the health care law and leave people without the insurance. When you take a look at this overall health care law, you see it as one where this body and this president raided Medicare, took $500 billion away from our seniors on Medicare, not to save Medicare, but to start a whole new government program. And now with the President's Payment Advisory Board, he additionally wants to ration Medicare. Ration Medicare. Rated Medicare? Ration Medicare? Is it any surprise that people on Medicare are having a much harder time finding a doctor as doctors refuse to see patients on Medicare? So with all of this, now we get this report. This report that says, and this is a very reputable national consulting firm, this report says that they did a survey of 1,300 employers across the country. Different industries, different geographies, different employer sizes, and the results really ought to be a huge wake-up call for all workers and all families across the country. Because what this group has seen from this study is that overall, 30% of all employers, 30% of all employers will either definitely or probably, so likely, stop offering employer-sponsored health coverage in the years after 2014. That's when Obamacare goes fully into effect. Now, among employers with a high awareness of how the program actually works for health care reform, who've actually studied what the law says, well, in that group, those who are most well-informed, they're saying more than 50% and upwards to 60% will pursue other options, likely to stop offering their employers health coverage. Well, at least 30% of the employers would gain economically from dropping coverage, even if they completely compensated the employees for the change of losing their insurance. This is very alarming for our country. And I will tell you, Madam President, that there was a really well-written editorial in yesterday's Wall Street Journal by Grace Marie Turner, and I'm going to have included as part of my testimony. She's the president of the Galen Institute and co-author of a book called Why Obamacare is Wrong for America. Having read the book, I will tell you a lot of the things I've been talking about during the debate leading up to the vote on Obamacare and that I've been talking about afterwards as a doctor's second opinion are included in her book. But she specifically writes about, no, you can't keep your health insurance. Now, there are about 150 million Americans who get their coverage at work. We're not talking about people on Medicare. We're talking about non-elderly Americans who get their coverage at work. The Congressional Budget Office, when we were debating the health care law, they estimated that, maybe 9 million, 10 million of those people, or about 7% of the employees who currently get their health insurance through work, may lose their health insurance at work, in spite of the fact that the president says if you like what you have, you can keep it. But this survey of 1,300 different companies, organizations that provide health insurance, 30% of them say, I don't think we're going to follow that route. Well, you're talking about a significantly larger number than the Congressional Budget Office had even anticipated. The numbers are astonishing. And in a study last year, Doug Holtz-Eakin, who is the former director of the Congressional Budget Office, he estimated, not what the current CBO said, maybe 10 million. He thought maybe 35 million workers would be moved out of employer-covered plans into subsidized coverage paid for by the taxpayers. And he thought by getting to that number, it would add an additional $1 trillion to the estimate of what the real costs were going to be for the president's health care law. If these numbers are true, this newer, higher number of 30% pulling out, and maybe 50% once they find out what's actually in the law and the mandates on these businesses, the additional costs, at a time when we're looking at 9.1% unemployment in this country. The costs are going to go even higher with the significant subsidies that exist for families making up to $88,000 a year. So I come to the floor, Madam President, to say that the more we learn about this health care law, the more unintended consequences, that many of the predictions made about this health care law from this side of the aisle are now coming true. And I've spoken in the past about waivers. We now are at a point where 3 million people who get their health insurance through work, 3 million people covered with health insurance in this country have gotten waivers. Whole states have gotten waivers so that they don't have to live under the mandates of the health care law, and they're going to be back for waivers again next year and the year after that. We see additional concern with what's really in this health care law. As Nancy Pelosi said, first you have to pass it before you get to find out what's in it. As more and more people find out what's in it, we're finding that more and more people who maybe had coverage that they liked are not going to be able to keep that coverage, are going to lose that coverage. And the taxpayers are going to get stuck footing the bill. And that's why I come back to the floor week after week with a doctor's second opinion, because there's new information that comes out week after week, as this McKinsey and Company study report came out this week. And that's why, Madam President, I continue to say we need to repeal and replace this terribly broken health care law. Thank you, Madam President. With that, I yield the floor and